You're not sleeping well. Your body feels like it's running a marathon while you're just trying to boil a kettle. Your joints ache, your brain feels trapped in a thick, wet fog, and your heart randomly decides to race at 2 a.m. So, you do what any rational person does. You make an appointment. You sit on that paper-lined exam table, look your doctor in the eye, and explain everything. And then comes that response. A polite smile, a soft sigh, and the words that feel like a slap in the face. Well, your blood work is completely normal. You're just stressed. Have you tried yoga? Maybe it's just anxiety. Or honestly, maybe it's all in your head. If you are a woman over 40, you know this exact feeling. The feeling of being erased inside a system that is supposed to heal you. But here is what nobody is telling you in that 10-minute appointment. You are not crazy. You are not exaggerating. And you are definitely not alone. Today, we are tearing down the wall of silence around 3 very real, highly complex conditions that women over 40 are constantly dismissed with. If you've been told to just live with it, grab a warm tea, sit back, and let's talk about what's actually happening to your body. Before we name these 3 conditions, we need to address an uncomfortable truth. Modern medicine has a historical blind spot when it comes to women's health. For decades, medical research was conducted almost exclusively on men. Clinical trials used male mice, male cells, and male human subjects under the assumption that female hormones were too complicated to factor into data. When a woman turns 40, her hormonal landscape begins a quiet, chaotic shift. Estrogen, which acts as a master key for over 300 different receptors in the female body, from the brain to the big toe, starts to fluctuate wildly. When these levels drop or spike unpredictably, the symptoms don't always look like a neat textbook diagram. They look complex, multisystemic, and vague. And because standard blood panels often fail to catch these rapid fluctuations, standard medicine defaults to its oldest diagnosis. It's emotional. Condition number 1 is often mistaken for early onset arthritis, depression, or chronic fatigue, but it is deeply tied to female biology. Perimenopausal, inflammatory, and neurological symptoms. Most people think menopause is just about hot flashes and missing your period. But estrogen is actually a powerful anti-inflammatory neurosteroid. It protects your cartilage, regulates how your nerve cells communicate, and manages serotonin in your brain. When estrogen starts dipping in your early to mid-40s, 2 major things happen simultaneously. First, systemic inflammation spikes. Your knees, fingers, and lower back begin to ache with a dull, persistent throbbing. Second, brain energy metabolism drops by up to 30%. This isn't just forgetting where you left your keys. This is standing in the middle of your living room and completely losing the thread of what you were doing 5 seconds ago. When women report this to their doctors, the standard response is often an antidepressant or a prescription for anti-inflammatory drugs that only mask the issue. But blood tests for rheumatoid factors usually come back negative. Why? Because the problem isn't a primary joint disease. It's the sudden withdrawal of the very hormone that kept your tissues lubricated and your brain firing smoothly. Remember this key takeaway. Estrogen isn't just a reproductive hormone. It is a brain and joint protector. Condition number 2 is a silent thief that targets women over 40 at a rate 8 times higher than men. Subclinical hypothyroidism and autoimmune Hashimoto's. Picture your thyroid as the gas pedal for your cellular engine. It controls your metabolism, your body temperature, your hair growth, and your mood. As women enter their 40s, autoimmune activity frequently ramps up. Your immune system slowly starts producing antibodies against your own thyroid tissue. Here is where the frustration lies. You go to the clinic feeling constantly cold, gaining unexplained weight despite eating clean, losing hair in the shower, and feeling a soul-crushing exhaustion that sleep cannot fix. The doctor orders a standard TSH test. The lab result comes back as 4.1. The medical reference range says normal is anywhere from 0.5 to 4.5. The doctor hands you the paper and says, "Your thyroid is fine." But functional medicine and modern endocrinology tell a very different story. Optimal TSH for a woman to feel vibrant is usually between 1.0 and 2.0. A TSH of 4.1 means your brain is screaming at your thyroid to work harder, but nobody is listening to the scream. Furthermore, standard panels rarely test for TPO antibodies, the markers that reveal if your immune system is attacking your thyroid long before the standard TSH test turns abnormal. You are left suffering for years simply because your numbers haven't crossed an arbitrary laboratory red line yet. Condition number 3 is perhaps the most misdiagnosed and dismissed of all: hypermobile Ehlers-Danlos syndrome combined with mast cell activation syndrome. Collagen is the glue that holds your body together: your skin, your blood vessels, your gut lining, and your joints. Women have naturally more flexible collagen than men, but for millions of women, that flexibility comes with a hidden cost. Throughout their 20s and 30s, their bodies manage to compensate, but when estrogen levels shift in their 40s, collagen structure undergoes further changes. Suddenly, in your 40s, the system unravels. You develop strange, seemingly unrelated symptoms: unexplained digestive distress and bloating after eating safe foods, sudden allergies, skin flushing, or mysterious hives, dizziness or a racing heart when standing up from a chair, chronic, migrating joint pain that shifts from your shoulder to your hip. Because these symptoms span 5 different medical specialties: gastroenterology, cardiology, dermatology, rheumatology, and psychiatry, no single specialist sees the whole picture. The cardiologist says your heart is fine. The gastroenterologist calls it IBS. The dermatologist gives you a cream. And when you put them all together, your primary care physician assumes it must be psychological. But it isn't psychological. It is a connective tissue and immune regulation issue that requires integrated care. So, where do we go from here? How do you take your power back when you've been told it's all in your head? Here are 3 practical steps you can take starting today. First, request specific, comprehensive panels. Don't settle for a basic TSH or a routine CBC. Ask for a full thyroid panel, including free T3, free T4, and TPO antibodies, and a comprehensive metabolic and hormone assessment. Second, track your symptoms with dates and data. Keep a 30-day symptom diary. Note your sleep, energy levels, joint pain, and menstrual cycle changes. When you present data instead of vague feelings, it changes the conversation in the clinic room. Third, seek a collaborative healthcare provider. If your doctor dismisses your symptoms twice without investigating further, remember this: you have the absolute right to seek a second opinion. Look for practitioners who specialize in menopause medicine, functional endocrinology, or integrative women's health. Your body is not broken, and you are not imagining things. The changes happening in your 40s are real, biological, and deserving of proper medical attention and respect. Have you ever been told that your symptoms were just stress or in your head? What did you do to finally get answers? Share your story in the comments below. Your experience might be the exact reassurance another woman needs to read today. If this video brought you clarity or peace of mind, please hit the like button and subscribe to our channel. Share this with a sister, a friend, or a mother who needs to hear this today. Thank you for watching. Take care of yourself, and remember, listen to your body. We'll see you in the next video.